After it has come down from the jugular foramen, it will lie next to the vagus nerve and the spinal accessory nerve. So we have seen those two nerves in the previous diagram. Let us say that's the one which I am talking about. So this is our glossopharyngeal nerve, that's the vagus nerve and the accessory nerve. Now while they are inside the jugular foramen, they will receive some communication from the glossopharyngeal nerve. Let us say this is the communication branch. That's the communication branch. So in the initial part of the glossopharyngeal nerve, I get two branches. One is the communicating branch, that is between 9th and the 10th cranial nerve. So they are exchanging the information. Then there will be the first branch that we described was the tympanic branch. After it has come down below the jugular foramen, it will lie close to the styloid process. But before it reaches the styloid process, it has one important relationship, that is, it lies next to the internal jugular vein, which also comes from jugular foramen, along with the 9th, 10th and 11th cranial nerve, and it also lies in relation with the internal carotid artery. So let us say that's the internal carotid artery. So that's my internal carotid artery. This internal carotid artery comes from the common carotid artery. This is my internal carotid artery. The common carotid artery also gives one branch which is called external carotid artery. So let us say this is my external carotid artery, which is a branch of common carotid artery. So my glossopharyngeal nerve is related to two important vessels. One is the internal carotid artery and internal jugular vein in the initial part. So let us say here, upper 1/3. Then it passes between the internal and external carotid artery, then lies deep to the styloid bone, then it lies above the stylopharyngeus, and then deep to the hyoglossus. So these are the important relation of the glossopharyngeal nerve extracranially. Now let us go to the next branch. Let us say this is the external and internal carotid artery, and at the junction of external and internal carotid artery, I get one small elevation which is called carotid body and carotid sinus. So let us say this is my carotid sinus anteriorly and carotid body posteriorly. So that's anterior dilatation and that's posterior dilatation at the junction of common carotid artery. The sinus is concerned with baroreceptor, whereas the body is concerned with chemoreception. That means they are concerned with change in blood pressure and they are concerned with change in chemical composition like O2 and CO2. More potent is CO2 changes. So this regulates the cardiovascular system and it is sensed by our glossopharyngeal nerve. So let us say after it has given two ganglion, it gives a branch which goes and supplies the it supplies the carotid body and sinus. So let us say that nerve is the nerve which supplies the carotid body and the sinus. Now this type of functional component which take the sensations from a changing blood pressure and changing chemical composition to the cranial nuclei of the glossopharyngeal nerve belongs to a category called general visceral afferent. So that's my second component. General visceral afferent deals with the change in the chemical baroreceptors and chemoreceptors and it is sensed by the nucleus in the brainstem, that is solitary nucleus. Or we can say tract. Okay, so that's my second component of the glossopharyngeal nerve. The first component which we saw was general visceral efferent. That's the one which will be carrying the preganglionic parasympathetic secretomotor fibers from the glossopharyngeal nerve, and the functioning area for GVE is the inferior salivatory nucleus. Inferior salivatory nucleus presence in the brainstem, like we had the superior salivatory nucleus present in the pons. This is present in medulla oblongata. So if you have not seen my video of facial nerve, you can just go back and then you will understand how we got the superior salivatory nucleus. This is like inferior salivatory nucleus. So I have the two components now with me. Inferior salivatory nucleus controlling the general visceral efferent fibers going to the parotid gland, and the second fibers which are coming from the tractus solitarius via the glossopharyngeal nerve through the nerve to the carotid body and sinus, which will be sensing the change in the pressure or the chemical composition of the blood. After this, the glossopharyngeal nerve gives branch to the stylopharyngeus. Now I am telling you, stylopharyngeus is not a simple muscle. It's a muscle which is derived from branchial arches. So this belongs to third branchial arch. So anything which is derived from the branchial arch become special. So in this case, the pharyngeal arch derived stylopharyngeus muscle, the functional component for the glossopharyngeal nerve will be special visceral efferent column. That's my third column. Special visceral efferent are the one which are concerned with pharyngeal arch derivatives. So in this case, I have the stylopharyngeus muscle. That's my third. After that, the nerve will go behind the muscle called hyoglossus. This muscle, the nerve lies deep to this muscle and then reaches the posterior one-third of the tongue. From posterior one-third of the tongue, that is this part, it will carry two important functions. One is the taste sensation and second is the general sensation. It not only takes sensation from posterior one-third of the tongue, but it also takes the anterior two-third, some part of the anterior two-third, that is the area where there is a circumvallate papillae. So let us say circumvallate papillae. So what we are understanding, it is taking general sensation as well as it is taking a special sensation. So let us say the general sensation from the posterior one-third of the tongue, that is touch, pain, temperature, etc. These are all belongs to the general category. So we call general somatic afferent. That's my fourth component. And the taste sensation from the posterior one-third of the tongue plus the circumvallate papillae belongs to another type of category, that is special visceral afferent column. So this is my last and the important functional component of the glossopharyngeal nerve. So from the posterior one-third of the tongue, it takes two important sensations. One is general sensation, so we call general somatic afferent. Not only from posterior one-third of the tongue, but it also takes from tonsillar region, part of the pharynx and uvula. Plus it takes a taste sensation fibers, which is called as special visceral afferent, from posterior one-third of the tongue and circumvallate papillae. These sensations will go ultimately to a nuclei called solitary nucleus, that is solitary tract. Okay, so this entire course of the glossopharyngeal nerve along with the functional component, let us revise the functional component. The first functional component which we said was general visceral efferent. This is carried by the lesser petrosal nerve. So the glossopharyngeal nerve enters into the middle cavity, ear cavity, through tympanic branch. It will form tympanic plexus with other nerves. From there it will give out lesser petrosal nerve, which will come out from the roof, enters into the foramen ovale and then reaches the otic ganglion. From there it will take the help of fifth cranial nerve, that is the mandibular division of the trigeminal nerve, auriculotemporal branch, and then reaches the parotid gland, which will increase the secretion of the parotid gland or control the secretion of parotid gland. That component is called a general visceral efferent. The second component which we said was supplying the carotid body and the sinus. This component is called general visceral afferent column. The general visceral afferent column is the one which will be taking care of the carotid body and sinus, and it will be related to the tractus solitarius. Stylopharyngeus was the third, which will be like special visceral efferent because it is derived from the third pharyngeal arch, and ultimately it reaches the posterior one third of the tongue, where it carries two sensation. One is a general sensation, not only from posterior one third but also from tonsillar areas and pharynx, which is called general somatic afferent, and taste sensation from posterior one third of the tongue and the circumferent papillae, which is called special visceral afferent. So glossopharyngeal nerve has 5 components. Now the glossopharyngeal nerve lesions, so isolated lesion of the glossopharyngeal nerve are rare. Normally the lesions of the glossopharyngeal nerve occurs at the jugular foramen. Along with that we will have the other two nerves, that is the 9, 10 and 11 nerve is injured. So this nerve injury where the 3 nerves are involved are called jugular foramen syndrome. This is given in Keith and Moore, where the 3 nerves are involved due to some tumor or lesions. In jugular foramen, we have to remember there is a vein called inferior petrosal sinus, which is also closely related to these 3 cranial nerves. Now if you want to test the glossopharyngeal nerve lesions, you can test the posterior one third of the tongue as well as circumferent papillae, that is for taste and general sensation, and also posterior one third of the tongue for general sensation. Normally when you touch the posterior one third of the tongue, there is a contraction of the pharyngeal muscle. So that tells you the intactness or the conduction or the nerve is normal functioning in the posterior part of the tongue, that is in the pharyngeal region. Hope you like the lecture. Please comment if you need any other lecture. Thank you.